Hello and welcome again. Now we will be moving forward to our another question discussion, and that will be the we are discussing this question number 29. That is, a 10-year-old child develops glomerulonephritis a week after he was treated for a sore throat. So there was a sore throat infection, and sore throat infection, after sore throat they develop this glomerulonephritis, that is called post streptococcal glomerulonephritis, because you have a sore throat due to streptococcal pyogenes. This is streptococcal pharyngitis, and the causative agent is identified by serotyping of and obviously this is the serotyping of M protein. So you have to understand, they are talking about this streptococcal pyogene. Streptococcal pyogenes is actually, if you go through your this picture, then when you go to the streptococcal pyogenes, then you will understand that this streptococcal pyogenes is actually a bacteria that will cause you the pharyngitis, and after that, that pharyngitis will lead to the rheumatic heart disease, as well as they will lead to the post streptococcal glomerulonephritis. And that is the important because of this antigenic mimicry of this M protein that is present. And if you remember, Enterococci bovis, Streptococcus agalacti, then Streptococcus pyogenes, and if you see there, this pyogenes have this this hyaluronic acid capsule and M protein inhibit phagocytosis. Antibody to M protein enhance the host defense against the Streptococcus pyogenes, but can give rise to rheumatic fever. So this is the rheumatic fever develops due to this M protein, which helps in what? Which helps to develop the antibody. The antibody develops against the same protein, but the similar antigen is present in the heart and the kidney, and that actually attack, when the bacteria goes away, they will go and attack the normal tissue and then cause the rheumatic heart disease as well as this post streptococcal glomerulonephritis. And then in the basis of this M protein, it has been serotyped, so that you have to understand. Let's move forward. There will be a one 8-year-old boy present to the emergency department with vomiting and severe cough. So there are some points which you have to remember. Okay, so there is the boy, that is the 8-year-old boy, that is present to the ER with vomiting and severe cough, in which he can't catch his breath. His vaccination is incomplete. Physical exam, cerebral fever, conjunctival injection. So there is a fever as well as conjunctival injection, and nasopharyngeal spirit grew gram-negative coccobacilli on a boarded gingiva medium. So they have given you a lot of information over here. This is the 8-year-old boy which has been present to the ER, where he is presenting with the severe cough, which he can't take it breath. So it is a severe cough in this way. And his vaccination history is incomplete. So we are not sure about his vaccination history. Now there is the fever and conjunctival injection. So when there will be this continuous cough, there will be the conjunctival injection. Why? Because of the pressure effect also there will be this is the case of the Bordetella pertussis, and they have given you, by this only you cannot reach, although severe cough will help us, and as well as fever and conjunctival injection with incomplete vaccine history will lead you to the Bordetella pertussis infection or pertussis infection. But they have narrowed down, they have given you another information, that is, there is a gram-negative coccobacilli and bordered gingiva media, and you know on the bordered gingiva media we grow the Bordetella pertussis. So you have reached to the Bordetella pertussis action. Now, what is the mechanism of action of this toxin involved? So, pertussis reaction that acts by increasing cyclic AMP. You remember the formula, and we will go to there. So, let me take over there to you understand. So, we will talk about the toxin. So, toxin will is in above. So, before gram positive, you can see this was the Staphylococcus streptococcus. We are talking about this Bordetella pertussis, and if you were talking about the Bordetella pertussis, there was the formula like CAAMP, camp. This C for cholera, A for anthrax, M for we can just opposite to this, so it become E. coli, and P for pertussis. So talking about this pertussis, this all act by increasing cyclic AMP. So cyclic AMP will be activated, but they are asking about how the cyclic AMP got activated. And if you remember, the cyclic AMP get activated in Bordetella pertussis by inactivating the inhibitory GI subunit. So in case of Vibrio cholera, they actually activate the GS protein. So they bind to the GS protein, activate it, and increase the cyclic AMP. But in Bordetella pertussis, they doesn't activate the GS protein. They actually inhibit the inhibitory protein. So they inactivates inhibitory GI. So they inactivates inhibitory component. That is important. So that is very much important to understand you. So they actually inactivates this inhibitory GI component, and then which cause activation of the adenyl cyclase. So adenyl cyclase can be activated by activating the activating protein, that is GS protein, or by inhibiting the inhibitory protein. So if there is an inhibitor, you remove the inhibitor, again it will be activated. So this GI inhibitor will be inhibited by Bordetella pertussis and the action occurs. So let's go to our question and we will find the answer. So ADP ribosylation of the eukaryotic elongation factor 2. This is the feature of your this Pseudomonas and Corynebacterium diphtheria. We are not, this is out. ADP ribosylation of the GI. Yes, this is the answer, because we know this was one of our answer which we are talking about. So this is your answer. B is your answer, because we have discussed that Bordetella pertussis will increase the cyclic AMP by inhibiting the GI protein. ADP ribosylation GPT binding protein. This is the GS protein that will be an action of your Vibrio cholera. Blocks the release of acetylcholine, that is of Clostridium botulinum, and it blocks the release of inhibitory transmitter GABA and glycine, that is of your Clostridium tetani, tetanus plasmine. What is, let's move to the another question. What is the typical means of transmission of toxin that blocks the release of inhibitory transmitter GABA and glycine? We know if you go to the same toxin, we have this Clostridium tetani and Clostridium botulinum. Clostridium tetani release titanospasmin. They produce the snare protein that damage the inhibitory GABA and glycine release by inhibiting this RANSA protein. So what happened? In case of the Clostridium tetani, that release the titanospasmin that blocks, that cleave the snare protein, that is the RANSA protein, and cause you the inhibit the release of this GABA and glycine. So there is a neurotransmitter from the cell in the spinal cord that is prevented, that is not released from the RANSA cell, this inhibitory GABA and glycine. So this is of titanospasmin, Clostridium tetani, and that causes spastic paralysis, rhizus sardonicus, trismus, and opisthotonus. So this was the feature of your Clostridium tetani, and the question was, what is the typical means of transmission of toxin that blocks the release of inhibitory GABA and glycine? So we know they are talking about your Clostridium tetani. So Clostridium tetani, what are the features? They are not going to directly ask about the Clostridium tetani. They are asking you something else, but about Clostridium tetani. So how this get infected to us? How you will get this Clostridium tetani? They are asking you actually, tell me the bacterial name that release this GABA and glycine and how that bacteria get spread. So first we need to do the diagnosis. The inhibitory GABA and glycine neurotransmitter is blocked by the bacterial toxin, that is titanospasmin, which is released by Clostridium tetani. And Clostridium tetani, how this get transmitted? By eating home canned food? No. By fecal oral? No. Infant giving honey? This is a botulinum. Puncture wound? Yes. This is the puncture wound by which we get this Clostridium tetani spore. And then germinate, they form the bacteria, release the toxin, then develop they damage our RANSA cell in the spinal cord, snare protein, and then block the release of GABA and glycine, and then we develop this spastic paralysis in the whole body. Hope you are understanding. So now we can move even further, and an infant present to the emergency department due to difficult breathing, constipation, anorexia. So there is a they came to an infant to the ER with difficult breathing, constipation, anorexia. Upon examination, the physician note flaccid paralysis. So if you again go back to your exotoxin endotoxin portion where we have discussed about the Clostridium tetani, this was causing spastic paralysis. But if you talk about the Clostridium botulinum, there's a botulinum toxin, same action is they inhibit the snare protein and they inhibit the release of this acetylcholine, cause botulism, that is caused by injection of the spore from the soil and raw honey, toxin production in vivo, foodborne botulism caused by injection of preformed toxin, and this toxin cause you the flaccid paralysis because they block the release of your acetylcholine. So they're giving you the picture of this flaccid paralysis with constipation, difficult to breathe, and anorexia. A toxin screen of the stool identify the agent. So when they were screening the stool, they find a toxin. What is the mechanism of action of that toxin? First, you need to identify the organism, then you need to identify the toxin, and then you will know how the mechanism of action of toxin occurs. So the diseases: botulinum, infantile botulism. What is the toxin identified? Botulinum toxin. What is the mechanism of action? Obviously they inhibit the release of acetylcholine, so block the release of acetylcholine, and you have to find in your option. So ADP ribosylation eukaryotic factor 2, this is of current bacterium diphtheria and Pseudomonas aeruginosa. ADP ribosylation of GI, Bordetella pertussis. ADP ribosylation of GTP binding protein, this is Vibrio cholera. Block the release of acetylcholine, this is Clostridium botulinum, that is botulinum toxin, and inhibit the release of transmitted GABA and glycine, that is of Clostridium tetani. So this is the clinical picture of your botulinum. So your answer is D, that is block the release of your acetylcholine, and in this way you can move forward. Okay, so let's move one more question, and then we can actually one or two question, and then we can stop, and then we can move further in the next lecture. So we are talking about this 30 in question number 33, a 10-year-old girl with an incomplete vaccination. So obviously they are talking about some of the vaccine preventable diseases. So there is incomplete vaccination present. So there is incomplete vaccination. So we are finding there is incomplete vaccination history present to have the pediatrics with fever, that is 101.5 degree Fahrenheit, sore throat, malaise, difficult breathing. So there are incomplete vaccination with fever, sore throat, malaise, difficult breathing. Physical examination reveals cervical lymphadenopathy and gray leathery exudate in the rear of the oropharynx. So they are giving you a picture where there is a pharyngitis with a pseudomembrane in your throat, and you know the organism now. This should be click in your mind. Okay, this is streptococcal pharyngitis. No, this means the Corynebacterium diphtheria infection, because there is the lymphadenopathy as well, and as well as there is the sore throat, fever is high, malaise, difficult breathing, all this feature of you because of you developing this diphtheria. The area bleeds profusely when distributed with the tongue depressor. This gives you another clue that this membrane, pseudomembrane, easily bleeds to touch, and that is the feature of your this pseudomembrane. This is due to a Corynebacterium diphtheria. So which of the following correctly describe the causative agent? Now we have to understand, okay, Corynebacterium diphtheria, what was the Corynebacterium diphtheria doing? So Corynebacterium diphtheria is the gram-positive bacteria, and then you have to understand about the diphtheria. So let me take you over the Corynebacterium diphtheria, then you will understand what type of bacteria it is. So Corynecutaneous Bacillus anthrax, pulmonary Bacillus cereus, Clostridium, Corynebacterium diphtheria. So what is the bacteria? This is the gram-positive rods, that is you have to understand, and this is the main important point, gram-positive rods. Now let me, gram-negative rod, no, gram-negative rod, no, gram-positive rod, yes, aerobic rod, yes, toxin and inhibit protein synthesis, yes, that is the important point. Gram-positive anaerobic rod, cancel, gram-positive aerobic rod, toxin that increase cyclic AMP, no, this is the actually what type of organism? These are the gram-positive rods that actually inhibit the protein synthesis via ADP ribosylation of elongation factor 2. So actually you can see over here this ADP ribosylation of elongation factor 2 is the important feature. So this is also adding over there. So they are talking about not only the bacteria, gram-positive, gram-negative, they are talking about this is the gram-positive aerobic bacteria that inhibits the protein synthesis, and this is your answer. Okay, let's move further again. A 38-year-old man who recently visited India on a business present to the emergency department with a profuse watery diarrhea, flecked with the mucus and severe dehydration. Which of the following correctly describe the causative agent? So they are giving you one of the picture. Say a businessman from the United States of America, or say any European country, they came back to the Asia in India, and India they have this some of the food items, and after eating that they develop this profuse watery diarrhea with flecked mucus and severe dehydration. And if you are talking about this profuse diarrhea, then you have to understand with flex and severe dehydration, then they are mostly talking about this Vibrio cholera. So you have to understand there you can have diarrhea because of a lot of reasons like enterotoxigenic E. coli, Vibrio cholera, then there will be other feature Campylobacter, or there are a lot of bacteria, but the rice watery voluminous diarrhea, severe diarrhea is occurring due to this Vibrio cholera. Now they are asking about the Vibrio cholera, what are the features? Let me see over there. If you first, let's go to the Vibrio cholera. So it's a gram-negative organism. Let me take over there, and you can revise from here. Neisseria, then Haemophilus influenzae, Bordetella pertussis, Brucella, Legionella, Pseudomonas, Shigella, Yersinia, lactose fermenting yeast, Enterococcus, Klebsiella, Campylobacter, now Vibrio cholera. So Vibrio cholera is what? This is the gram-negative organism, carved organism. They are oxidase positive. They grow in the alkaline media. They are endemic to the developing countries like India and Nepal. Profuse watery, rice watery diarrhea via toxin that activates the cyclic GS protein, increase cyclic AMP. They have a lot of information. This information will be enough to. This information will be present in your question. So they are saying which describe. This is the gram-negative carb rod. Yes, this is the gram that increase the cyclic AMP. Yes, that is also true. Gram-negative carb rod toxin that inhibit the protein synthesis. Not, that is not true. Gram-negative rod that toxin increase cyclic AMP. Toxin that increase cyclic AMP. So gram-negative carb rod and gram-negative rods. We know these are the gram-negative carb rod. So the answer is A in comparison to C. Although C seems to be an answer correct, but the more specific will be A, because these are gram-negative, that is carb and increase the toxin that increase the cyclic AMP. Okay, gram-negative reduced and protein synthesis is not intoxication with level toxin, that is also not. So the answer is A, that is the gram-negative carb rod. Although C can be your answer, but the A will be more specific because there is an additional point of carb rod. Gram-negative rod that increase cyclic AMP can be E. coli, can be enterotoxinic E. coli, but Vibrio cholera will be gram-negative carb rod that increase the cyclic AMP. Okay, let's move one more question and then we'll end over here. So a 30-year-old man present to the physician with a complaint of mid-epigastric pain. He described the pain as a moderate, occasional walking him at night, improved immediately following meal. So there is a person that is having the abdominal pain that is related with your food habit. After taking meal, if the pain goes away, there are two types of, that is called peptic ulcer, gastritis, peptic ulcer disease. So if you have a stomach ulcer, then after taking food, the pain will be aggregated and duodenal ulcer will be relieved. When in empty stomach, actually the food has the relation with this gastric ulcer. After taking food, if a person pain of abdominal pain goes away, then you have to understand this is a peptic ulcer disease, which is caused by Helicobacter pylori. So we are now dealing with the H. pylori. So they will give you more information. They are giving a urease breath test was positive. So now this abdominal pain can be due to a lot of reasons, but due to bacterial cause, they will have now narrowed down to the urea breath test was positive, which is urea breath test is positive of with this Helicobacter pylori, obviously. And which of the following correctly describe this causal division? These are the gram-negative, oxidase positive carb rod. Let me take you to this Helicobacter pylori. This is the carb flagellated gram-negative rod that is triple positive, catalase positive, oxidase positive, and urate positive. So they are urea breath test positive, as well as there are gram-negative carb motile triple positive. So this will be the feature that we need to understand, we need to remember, and this will be over here. This is a gram-negative carb rod, microaerophilic, gram-negative rod, aerobic, gram-negative rod, facultative anaerobic, gram-positive rod, aerobic, gram-positive rod, microaerophilic. So this gram-positive is neglected. Now gram-negative. In gram-negative also, these are the carb rods. So gram-negative carb rod as well as microaerophilic will be your answer. So gram-negative carb rod and these are 3 positive is your answer. So in this way, you can deal with your questions. You have to first identify the organism, you have to first understand the scenario, then identify the organism, and they are not will be asking you just about the organism, they will ask you about the feature of